Welcome to the webinar, Take Charge of Your Schedule and Increase Production and Efficiency. In this webinar, I will give you implementable ways for how to take control of your schedule and ensure that you consistently run on time, which is so important for having a great patient experience. We will also discuss how to make schedules more productive. Before we jump into the webinar, I want to pause for a moment for a few introductions. My name is Mike Smith. And during this webinar, I will pull from my experience in coaching and training dentists and teams to improve all aspects of practice and team performance. I will also be pulling from the book I wrote, The Path to Greater Dental Practice Success. Now, I have the good fortune to work for an innovative dental CPA and consulting firm, Fluence. We're based in Portland, Oregon, and we're proud to be part of the Academy of Dental CPAs, a nationwide network of like-minded CPA firms. Now that we've completed our introductions, let's jump into the material and let's look at an all too common situation. Have you ever had one of those days where you literally run from room to room trying to keep up? You barely have any time for lunch and you finish much later than you had hoped. And even when you look at the production reports, your production is lousy after all of that running around. Now, if this is just a rare occurrence, that's one thing. But unfortunately, this is all too common for dentists and teams. If you consistently run behind, how can you expect patients to refer their friends and family? One of the main reasons why patients will leave practices is because those practices are not running on time. How then can you learn to schedule more productively and efficiently? Well, first, let's pause and consider the question about how everyone in a practice perceives time. Whenever I consult with dentists and teams about their schedule, I like to get everyone's perspective on time. You see, it passes differently. For doctors, for example, their focus is on the patient in the chair. They're doing work in an operatory or they're doing an exam. Time passes differently for them than for the rest of the clinical team. The clinical team is certainly involved in patient care, but they're also involved with trying to keep the doctor flowing and on time. The front team has a different perspective as well, because unfortunately, when things run late, the front team typically hears about it. Therefore, as you start this discussion in your practice and you look at your schedule and whether or not you're running on time, it's important to understand that each person in your practice has a different perspective. And it's important to understand that perspective as we move forward in our webinar. Why is it then that practices run behind? Well, the first reason we'll discuss involves emergencies. Now, emergency visits are part of dentistry, and patients are very appreciative when they're in some type of discomfort and they are able to get in to be seen so that they're out of discomfort. However, when you are fitting patients in for an emergency visit, you have to understand how this impacts your schedule. When you are squeezing patients in for an emergency, who does that impact? Well, it impacts patients who had already pre-scheduled. And those patients are the ones who are the most invested in your practice. So therefore, when you inconvenience your most valuable patients, those who are most invested, you do undermine practice growth, all at the expense of trying to get in an emergency. Fortunately, there are better ways to schedule emergency patients, and we'll talk about that so you can accommodate their needs while also consistently running on time. The next reason why practices will commonly run behind is because of new patients. And new patients typically have the greatest number of questions. They have the most comprehensive of treatment plans. And again, when you run behind because of new patients, you will inconvenience everyone else on the schedule. And once again, we'll talk about ways to schedule new patients to be able to effectively address their needs while also consistently running on time. Third reason why practices will run behind is because recall exams, they're not the priority they need to be. I mean, without recall exams, the doctor's schedule would not be busy. However, when you understand the doctor's perspective, I mean, recall exams are technically an interruption in his or her time. But if we're not managing those interruptions effectively and managing those exams effectively and making them the priority they need to be, the schedule will run behind. We'll talk about a number of things to keep in mind when scheduling and keeping the doctor's time for recall exams in mind. The fourth most common reason why practices will run behind is simply there's not enough time scheduled for treatment. And once again, when you're looking at this, you have to remember that each person has a different perspective of how much time is needed. When the doctor leaves the operatory, it does not necessarily mean that appointment is finished. The clinical team often will have post-operative procedures to take care of, or they'll need to clean up that room. So these things need to be taken into consideration when you're looking at scheduling an appropriate amount of time for treatment. One of the most eye-opening exercises you can do in your practice is to track on-time performance. Do this over the period of 3 or 4 weeks, and you'll start to pinpoint those procedures that consistently run behind. You'll also be able to examine the schedule and consider the parameters that were involved in running behind. Sometimes the same procedure will run on time on certain days, but when you have additional hygiene visits, then it starts to run behind. So I encourage you to do that. The final reason we'll discuss in terms of why practices run behind is that extra treatment gets added to an appointment. And this is always done with the best intentions. You have that patient in the chair who you want to accommodate and not have to have that person come back. However, I encourage you when you do this, and then we'll talk about this a little bit later in the webinar, you need to consider the impact to everyone else who is pre-scheduled whenever you add that additional treatment. So what are the results of ineffective scheduling? When schedules consistently run behind, when they're not as productive as they need to be? Well, first of all, you inconvenience patients who have already pre-scheduled, patients who are invested in your practice. You'll potentially lose out on new patient referrals. Who wants to refer their friends and family to a practice that does not run on time? When the doctor and team are rushed, it tends to decrease treatment acceptance. A lot of questions go unanswered. And overall, you have higher stress for the doctor and team, as evidenced by the picture on the screen, and lower production. Fortunately, though, there is a better way. As we head toward that better way, though, let me show you an example of ineffective scheduling, what it looks like. On your screen, you'll see 4 columns. The 2 columns on the left are doctor's columns. The 2 columns on the right are for hygiene. And wherever you see an X, that indicates the doctor's time. That's where the doctor is needed. So in this particular day, the day starts in operatory 1 for the doctor with a crown seat. And it goes pretty well for that first bit. But then a denture adjustment is put in the schedule. There's not going to be quite enough time to turn that room around, so the denture adjustment will start to run late. The emergency exam will start to run late. And to start to visualize this, in red, you see everywhere where that doctor is needed once that crown seat is finished. By the time we finish the first hour of the day, by the time the doctor gets done with the exams and gets over and completes the hygiene exams, that doctor is going to be behind, probably 15 or 20 minutes. And it's only going to get worse because look what happens in the next hour. The doctor is committed chairside for those fillings. But yet in operatory 3, there's a new patient exam. In an operatory 4, someone who is already pre-scheduled is needed for a recall exam. Now, what kind of impression do you think is going to be made with that new patient appointment? The doctor is going to be running late and will be rushed. And for that hygiene visit, that patient will also be kept waiting. So this is the start of a very challenging day for this dentist and team. It's not the kind of day that you ideally want to see, and it does not make the memorable impression on your patients that you really want to be making. When you have a day like I just described, the goal just ends up being survival. And in the process of just trying to survive and get patients through the practice, think about every relationship building moment that you lose and you're not capitalizing on. And how do you build a practice like that? Even if this is happening just once a week in your practice, it's happening too often. But fortunately, there is a better way to schedule. The path to better scheduling is paved by first diagnosing what's wrong with your current schedule. And I encourage you to do that, to look at it very closely, to map out everything that is wrong with it. Because there are so many things you can do to make it better. And what we're next going to talk about are implementable ways to make your schedule more effective. Here are strategies for running on time. First, let's start with emergencies. We talked about emergencies being a challenge earlier. Well, reserve time for emergencies. And here's how you do this. High-performing teams, what they do, they manage emergencies in two ways. First, they think about what is typically the demand for emergencies. For example, if on Mondays you tend to average 3 emergencies, you need to make sure that you have 3 emergencies blocked off in your schedule at times where you can accommodate them. And then second, once you have this time blocked off, you guide patients into those openings. The other part of reserving time for emergencies and staying on time is time management during the appointment. So many times emergency patients will show up not only with an acute need, but with a laundry list of issues. So keeping to their chief complaint and rescheduling that patient when you can address those other issues is critical to help you be able to run on time. The second strategy for running on time involves new patients. Making sure that you have room in your schedule for new patients and not just assuming that somehow you're going to find the time, but you think about this and you proactively plan for your new patients. If, for example, you expect to get 20 new patients per month, you need to make sure then that you have 20 new patient spots open during the course of a month to accommodate those people. Do not just assume you can find a way to squeeze patients in. That's a terrible way to make an impression on a new patient. And keep in mind that when new patients call, they do not want to wait months to get into your practice. That's why it's very important to plan ahead and reserve time for these really important visits. In addition, make sure you have enough time set aside for new patient exams. Remember, new patients have lots of questions. Whenever needed, though, keep in mind that it's not an uncommon practice. In fact, it's a very good practice to bring patients back for a consult, typically coupled with their first step of treatment when they have a lot of issues going on. So plan proactively for your new patients. The third strategy for running on time is to schedule new patient exams and hygiene care on different days whenever possible. And this can be a challenge. It's a common challenge to balance the needs of patients with doing what's best for the patient in the practice. When new patients come in, you do not often know how much time is needed for that hygiene care that they're going to receive. By scheduling on different days, you can proactively plan and allocate just enough time, especially if patients have perio needs. But in doing this, you also want to consider flexibility. I'm a big believer in the concept of firm in principle, flexible in application. So firm in principle would be whenever possible, we schedule new patient exams and hygiene care on different days. But flexibility, when you have patients who have to have it done the same day and they meet certain parameters, you apply flexibility. And those parameters might be the patient has been in to see a dentist within the last year and they've not had treatment for gum disease previously. All right, let's look at the next strategy for running on time. And that is get to exams as soon as possible. Now, during most hours of a dentist day, there really is this tug of war that goes on. On one end of the rope is the patient that the dentist is treating. And on the other is the hygiene team, letting the patient or letting the doctor know, hey, we're ready for an exam. Keep in mind, though, to make this tug of war a lot easier, the exam does not have to occur at the end of a cleaning. Proactive teams and teams that have solved this issue let dentists know that an exam can occur as soon as films have been taken and any charting has been done. And it usually gives the dentist about a 40-minute window to go in and do an exam. And this is especially important when you have multiple exams to do in the course of an hour. So add this flexibility, and this will put more of a priority to get to exams as soon as possible. The final strategy is to schedule enough time for treatment. And this is something that requires a bit of discussion because, again, you have to keep in mind that time passes differently for each person in the practice. And this can be an eye-opening experience. And that's why it's critical to track your on-time percentage and really be able to pinpoint procedures. Because it might be from the doctor's perspective or maybe even a clinical team's perspective, procedures run on time, but the front office team may have an even better perspective about this, or maybe the clinical team does. But in any case, you need to really look at which procedures consistently run behind and why. Get to understand that. When you're mapping this out, also look at procedures that you overlap. What is your ability to stay on time when you're overlapping procedures? In particular, when you have multiple hygiene exams, et cetera, that have to be taken care of in the course of an hour. You also want to pay attention to how the schedule is impacted when the doctor adds additional treatment. Ideally, before additional treatment is added to a schedule, there's literally a little bit of a conference, and you are paying attention to how this is going to impact everyone else on your schedule. If you can do the extra treatment and still stay within the allotted time, that's fine. But if you're going to run late, it's almost always better to have that person come back. Why inconvenience the rest of your schedule? As you look at those ideas, those strategies, those 5 strategies for staying on time, you can now look at implementing something called a pre-block system. So again, the strategies: reserving time for emergencies, reserving time for new patients, whenever possible, scheduling new patient exams and hygiene care on different days, getting to exams as soon as possible, and scheduling enough time for treatment. Those are the 5 things you want to make sure you're doing. In addition, you want to determine what you need to produce for the day. I mean, that is an important aspect. And what is your ideal flow for the day? You may want certain procedures done in the morning versus the afternoon. When you have this put together, you can now start to think about your schedule in terms of blocks, and you can put together a pre-block system that can be very effective at helping you run on schedule, but yet be very productive and efficient in the process. Now, understandably, whenever a pre-block system is discussed, the front office team will often raise concerns. And I want you to keep in mind that a pre-block system is designed to be firm in principle, but flexible in application. So firm in principle, for example, whenever possible, the doctor has decided that crowns will be done in the morning. That's the firm in principle. But flexible in application recognizes that not all patients can come at 8 a.m. for a crown prep. There has to be a day or 2 a week where crown preps are allocated in the afternoon to accommodate those patients. You're in the service business. But by being firm in principle, not only is the front office team aware of those blocks, but the whole team, the doctor included, is involved with guiding patients into those time blocks. So the doctor would diagnose the crown and say, Mike, and let's get you scheduled for this crown. We typically like to do this first thing in the morning. So when you go to the front, let's get you in for a morning appointment. And that will make the block system much more effective. So keep in mind that even though you're putting together this system in terms of blocks, you're firm in principle, but flexible in application. Let's now look at an example of a block system. So on your screen, once again, we have 2 columns for the doctor, operatory 1 and 2, and we have 2 hygienists, 1 in operatory 3 and 1 in operatory 4. Every X you see represents where the doctor is needed. Now, things start out in operatory 1 with the crown prep. The doctor delivers anesthetic. This gives the hygiene team enough time to get x-rays in and charting. After that anesthetic is delivered, the doctor then goes over to operatory 3 to take care of that exam. There's not an exam needed in operatory 4. Well, the doctor will finish with that crown prep on time. The hygiene patients will be on time. Then the doctor moves over to operatory 3. There's an overlap there for the root canal. Anesthetic is delivered, and the doctor then has time to get over and complete the exam in operatory 3, as well as an exam in operatory 4. Then the doctor gets back in operatory 2 and completes the root canal. Everything is running on time. The crown prep in operatory 1 and the root canal in operatory 2 were scheduled with the idea not only how much time is needed for the procedure, but also how much time would be needed for exams. And that is built into the procedure. When the doctor then goes to operatory 1 to complete the fillings, after anesthetic is delivered, the doctor is able to get over and get the exam done in operatory 3, and so on and so forth. So the day flows really well. Now let's look at an example in the afternoon where we have a lot of small appointments, and I'm going to show you how that all flows together. This schedule was put together with the idea of the types of shorter appointments that would be placed. So for example, in operatory 2, the doctor completes a crown prep. Then we'll go over in operatory 4, complete an exam. Then back to operatory 1 for the new patient exam. There's plenty of time allocated for each of these shorter visits, and the day flows well in the afternoon. Then the doctor will complete a denture adjustment in operatory 2 at 4 o'clock. Then there's plenty of time for the doctor to go between the various operatories to complete exams on kids as well as emergency exams. So this is an idea of how new patients and emergency exams were put into the schedule and allocated, and enough time was put in place so the doctor would be able to go to the various operatories and complete what was needed. So you have a schedule that consistently runs on time, and the patient experience is not compromised because no one is rushing. Well, we've covered a lot of key points in this webinar. Let's review them. First of all, it's important in order to stay on time to reserve time for emergencies and new patients. We just saw that in the prior example. Whenever possible, schedule new patient exams and new patient hygiene care on different days, keeping in mind that you're going to be firm in principle, yet flexible in application. Make exams a priority to get to them as soon as possible, and do that by having within your team the communication that when x-rays and charting are completed, the doctor is then able to go over and complete that exam. That opens a much bigger window of opportunity, and it makes it so much easier to stay on time with exams. Schedule enough time for treatment. In doing this, you need to first track what's working well and not working well with your current schedule. Implement a pre-block system that's efficient and productive because you're keeping in mind how much time is needed, the ideal flow of the day, and your production goals. It's important to remember you need to guide patients into these pre-blocks, and that requires teamwork, as I alluded to earlier. That's not only the front office team's duty, it's also for the clinical team to guide patients into those blocks, to set that expectation in the operatory that a particular procedure is going to be done early in the day or later in the day. Keep in mind, you're in the service business. That's why you want to be firm in principle and flexible in application. And since schedules are fluid, they change, situations change, I encourage you to review schedules regularly. This will help you keep them tuned up and will ensure that they are as strong as possible. While implementing productive and efficient schedules, this requires continuous refinement. Please let me know how I can be a resource for you as you go through this process. And I encourage you to also check out the resource, the book I wrote, The Path to Greater Dental Practice Success. I wish you all the best as you put additional attention to how you schedule. With the right level of commitment from the doctor and team, you can take charge of your schedule and increase production and efficiency.